We're going to do a video today showing a real-time ultrasound of your abdominal muscles, and then we might do another video a bit later on showing a real-time ultrasound of your pelvic floor muscles. Now, when you go and see your physiotherapist at Sports Focus, this is a technique that we can use using a diagnostic ultrasound machine rather than a therapeutic one to visualize the abdominal wall. And your physiotherapist might decide that you need to have some deep abdominal muscle retraining. And one of the ways to really visualize that deep transverse abdominis, or your deepest core muscle, is to look at the layers of the muscles on the screen. So first of all, we have you lying down, and then we're going to put an awful lot of gel, which isn't warm, it's cold, on both the machine and on you. Now, when we do this in the practice, we'd normally have the patient set up so that they can see the screen, and obviously the physiotherapist will be working on the same side so that ergonomically it's good for them as well. So we'd start with popping the applicator head onto the abdominal wall at the lower end of the ribs and just above the iliac crest or the hip bone. So the transverse abdominis, which your physiotherapist will have talked to you about, is a big deep sheet of thin muscle that wraps around and connects deeply into the spine and helps to stabilize the spine. And it's sometimes quite difficult to feel that you're activating your transverse abdominis, and if you've had low back pain or any problems around the low back or the pelvis or abdominal surgery, then sometimes this muscle in its small but important stability role can get lazy. And the other abdominal muscles, the external and internal oblique, and sometimes the big six-pack, the rectus, will take over. Alright, so this is our setup, and then we might take a minute or two to find the best image. Alright, so we'll stop the video there and then we'll come back on so that you can actually see the screen.